This is your Diamond Insight of a call for accountability, the case of medical negligence. The tragic case of a 5-month-old baby losing her arm due to alleged medical negligence at Chipata's Level 1 hospital in Lusaka is a stark reminder of the fragility of healthcare rights in Zambia, particularly for minors. The family's plight, having sought care for a minor's illness only to face an irreversible outcome, raises pressing questions about the quality of medical care and the accountability of healthcare providers in our country. At the heart of this crisis is a reported incident of medical staff administering an incorrect dosage of medication, leading to severe damage and the eventual need for amputation. This incident, if confirmed, highlights not only a failure in clinical judgment, but also a breakdown in patient safety protocols. Such cases undermine public trust in the healthcare system and demand an immediate, transparent investigation. This is not an isolated incident, it is emblematic of systemic issues plaguing the Zambian healthcare system, from under-resourced facilities to insufficient oversight mechanisms. With healthcare professionals often working under challenging conditions, negligence cannot be excused. Lives depend on their decisions, and when these decisions result in harm, there must be accountability. We therefore challenge the Ministry of Health to take keen interest in this case and ensure that those responsible face appropriate consequences. This incident also calls into question the role of the Human Rights Commission in safeguarding the right to health, especially for vulnerable groups like minors. The right to health is enshrined in Zambia's constitution and the international human rights frameworks to which the country is party to. Yet cases like these reveal a gap between policy and practice. The Human Rights Commission must step forward to investigate whether the rights of the child were violated and whether systemic failings in the healthcare system contributed to this outcome. Their mandate should go beyond issuing statements. They must actively advocate the reforms that prioritize patient safety and hold institutions accountable. If the allegations of negligence are substantiated, they reflect a systemic failure to uphold the principles of care and safety. The loss of an infant's limb due to alleged negligence is a tragedy that should not be tolerated in any society. It is imperative for all stakeholders, government, healthcare institutions and human rights bodies to work collaboratively to uphold the right to health for every Zambian, especially the most vulnerable. Only through accountability, transparency and systemic reform can the nation prevent such tragedies and restore faith in its healthcare system.